I'm Deborah Van Kleef, and I'm really proud of Ohio this year. I think we're really going to do it, and we've got great friends here to help us. So we're all going to go out and vote early, right? And we're going to make the difference. This is Tom Paxton has this expression he uses for songs that are written. Thank you, Pat. That are written for the moment. He calls them short shelf life songs. And unfortunately, this is more of a long shelf life song. I wrote it in 1995, and it's just getting more and more current every day. But who knows? I think it's possible that we're going to see some change on this front. I woke up one morning, I was feeling sick. Called up the doctor to see me quick. Voice on the phone said with no hesitation, "If you've got insurance, you're our patient." I said, "It's just a sore throat. I'll pay the bill." She said, "Well, it'll be $85 to look at your tonsils and $150 to establish you as a patient." So I called around to some companies and I said, "I'd like to buy some insurance, please." And they said, "We've got to examine you first, find out if you're an acceptable risk. Got to make sure you won't actually get sick. You know, insurance is for healthy people." So they analyzed my blood and my pee, and they scrutinized every inch of me, took the medical history of all my relations back about a dozen generations. Then they said, "We gotta know one more thing. Do you have any pre-existing conditions?" "Just one," I said, "but it's terminal. It's called life." So they signed me up and they told me the terms for helping my body to fend off germs, with a co-payment here, deductible there, and a sky-high premium for each month's care. They said, "If you have to go to the hospital, don't worry, we'll be right there, looking over your doctor's shoulder." Well, I was starting to see where the problem lay and why I was having to pay and pay. I said, "This isn't really about my health. It's something to do with increasing your wealth." They said, "What country do you think you're living in? Cuba? Sweden? Australia? Mexico? Japan? Turkey?" That's right. Turkey is also on the list. "Singapore? Bhutan?" Well, the point is, with an attitude like that, you could be living in any industrialized country in the world, except for these United States, where there's 47 million of us out here on our own. Yes, healthcare ought to be guaranteed. It's about our lives, not some middleman's greed. And if we all get together and organize, we can have a new system. Get rid of those guys. Yep, we'll have universal coverage. Healthcare for people, not for profit. In fact, pretty soon we'll all be feeling so good we'll think we died and went to Canada.